My name is Amy Heithoff-Dominguez. Can everybody hear me okay? Wonderful. It is so cool for me to be on this stage. I'm so used to being out here to hear the symphony or a play or something like that, so it's quite an honor to be here to speak to you today. Thank you, Vicki and the committee. I am the Missouri counterpart of Dr. Teal. I'm the Missouri Action Coalition statewide director, and it has just been a match made in heaven. Truly, I have been so extremely involved in professional issues my whole career. I graduated with my BSN from Creighton University in 1985, and at that time, there was a nursing glut. There were so many nurses around that my colleagues and I were really having a hard time finding positions. So I moved away from Omaha because of that, and I started out in ICU at Research Medical Center and just had a really lovely time with intensive care, critical care, all of those great things that, thank God, 20-year-olds want to do that. So I'm really excited to hear that some of you want to go and do that, and others have other areas of interest too. I got my master's later in life at Central Michigan University in healthcare administration, and boy, do I wish I would have went to nurse practitioner school. Wow, that is the place to be at this point. And we'll talk more about that in a little bit. I don't think education is ever a waste. I think it's always valuable, and we can always keep going back. That's what we do in nursing. We just keep going back and getting smarter and smarter. Let's see, my professional career, as I mentioned, I started out in critical care, and then I did a dialysis, mental health, and then I started my own company about 21 years ago doing case management. And so I'm like triple certified in nurse case management, everything, however you want to call it, transitions of care, care management, all those things, and have very much enjoyed that role as well. So the reason I'm here today, though, is that we have come to a place in our nation where we have several problems all occurring at the same time. And when Congress has a question about health care, what they do is they put it out to the Institute of Medicine, which is the IOM. And the IOM started in the 1970s. And basically, the IOM is a think tank of extremely brilliant people who will figure out the answer to whatever question is proposed to them. And historically, many of you might have iPads with you now, so feel free to Google and learn along here as we go. They have done some amazing things in terms of patient safety, and now the most current, the future of nursing, which is really the future of healthcare. I'm going to skip over. I understand you've had a lot of education this morning about the actual IOM itself, and so I'll skip over that. And there's the four key messages, and then there's the 8 recommendations, which all go back, they all apply to one of those key messages. And so in Missouri, what's wonderful is that we have a lot of wonderful funding by Robert Wood Johnson. It's a very, very wealthy foundation that funds healthcare initiatives. And also, in addition to that, AARP, the Association of Retired Citizens, or Retired Persons now, and they have funded what is called the the Center to Champion Nursing. So those organizations really understand that we go to hospitals for nursing care, right? We can go to physician offices or provider offices for that care, but we go to hospitals for nursing care. I'm sorry, I may have said that wrong. So they are very concerned about the shortage of nurses and the quality of care, and they really want to support us. So we are thrilled and very excited to accept their help, because we know that it's not just about us. You know, we didn't go into this field to be wealthy or famous or all those things. In nursing, we typically go into this field because we really, really want to help people. And we care for people so deeply, we just can feel it in our bones. And we're happy when we can make other people happy. Am I touching on some heartstrings here, I hope? Are these things good? Okay, this is why you're here. Me too. And I've always been able to do that in whatever field that I've been in, whether it was critical care or mental health or wellness or even in case management. I'm always advocating for the patient. I'm thrilled about that. So I just want to share with you that you have wonderful careers ahead of you. You have so many opportunities to help people in just profound ways. In Missouri, we have had sometimes it takes a while in the middle of the United States. It takes a while for us to get on board with what the rest of the nation is doing, and we have done that, and we are doing it now with great aplomb. We were commissioned as an official action coalition last year. We sought funding, and we received it from the Healthcare Foundation of Greater Kansas City, took a big leap of faith and said, yes, we want to help nurses in Missouri, we want to improve healthcare, and so our initial grant was from them. And then I was hired in June 1st, and again, it was a match made in heaven, because I've been doing this work for a long, long time. My husband says, oh good, you get a paid trip to Jeff City. So it's been a great thing. I get to go out and talk to people about the IOM report and really help make those changes to our profession that we all know, we all agree with it, and we're like, great, it's nice that all those recommendations are now in one spot, in one document, and we have a great deal of support to implement these things in our state, in our nation. And Missouri has done things just a little bit differently than Kansas. We have 5 action teams, 5 pillars, if you will. We have the education team, of course, the yellow team. We have practice, which is the red. And we felt that we needed to split up advanced practice and practice because we had so much work to do in Missouri. Our APRNs, Advanced Practice Registered Nurses, a preferred term now, are basically, they have so many restrictions that it's just very difficult for them to practice. And some of them I just spoke with one at the break, has had to go out of practice because of a lack of a collaborating physician. And isn't that sad? That care cannot be provided because of the way we have our rules and regulations set up in our state. So we felt we needed some extra oomph to try and get what we call barrier-free practice or independent practice. And that goes directly towards that first key message that nurses should have full scope and practice to their full extent and breadth of their knowledge and education. So that is happening in 16 states right now. 16 states have full practice. Their APNs can open up their own shop, their own business, and see patients. And it's going very well. You can imagine the wonderful access to care that not just urban folks have, but also rural folks. We need to look at all the population of our states. And nurse practitioners, we know from many, many studies that not only is the quality as good or better, but we have amazing, amazing patient satisfaction. People really, really like to see nurse practitioners. And I would like to just put a call out to our audience. How many nurse practitioners do we have in our audience right now? Just raise your hand. 1, 2, 3, okay, we have some. Thank you so much for joining education and for being a nurse practitioner. I hope that all of you can meet some of them. I want to put a challenge out that if you have not seen a nurse practitioner in your own personal medical path, that you consider seeing one the next time you have an issue. I have done this personally since my children were very little. I have a 12-year-old and an 8-year-old, and I'm that demanding kind of mom where I don't want to wait till the next day or 2-3 days. I want my child's problem solved now. And so I ended up getting a nurse practitioner many times out of default and ended up so happy, so pleased. And I also want to put a plug in for the CVS's and the Walgreens, and Walmart too is right on. They're not going to be left out. They too will have nurse practitioner clinics. I had an opportunity to go to one recently with my daughter, and blown away with, I was just like, oh my gosh, this is how it's supposed to be. And it was amazing. And I also got right in to the pharmacy, which helped. So anyway, I just want to challenge you to encourage that. Test the waters, especially if it's something minor, not if you don't, the scope of practice with which you think they can handle, which is most things. So try that. In Missouri, we also have the leadership team, and we also have workforce. And we have, I'll go ahead and talk about each one individually. We just have a short amount of time here this morning. Our education team really had a lot of work to do. As we know, education is the basis for all things, and only good comes from it. We had a lot of scattered and just a lot of various ways and different curriculums and different standards. And please excuse me, because this is not my background as the educators are going, yep, it sure isn't, because you don't even know the words. But what I want to say is that we need a lot more standardization. We need credentialing. We need all those good things that will ensure that what we are teaching in our schools of nursing is uniform and that it is meeting the standards across the board, and that we don't have a rogue institution out here that maybe is not educating folks to the standard that we have grown accustomed to and the standard with which our citizens expect from us. So that is happening. We've had a number of different meetings. We now have a very defined articulation plan. We have everybody at the table. For the first time in our state, we had every leader of every healthcare institution, every nursing leader, and we also had some CEOs and administrators, and we had every dean or director of School of Nursing, every single one, in one room for the whole day. And we had amazing, amazing synergy and success and progress that occurred. And we've done that twice, and we're going to do it again next summer as well. We have taken that energy from those two meetings and we've divided, we've asked people to choose a committee. You can be on more than one committee, and we ask that you at least be on one, and that you attend by phone call, conference calls that are happening every quarter. So our next set of calls is going to be the last week of October. I have a slide a little bit later on with those dates. But you're welcome to call in and listen and speak up if you have something to add. So we have a plan. This was just a document that came out of our education committee, a great deal of work in a very short amount of time to try and get all the schools of nursing, the associate degree, the LPNs, the BSNs, all on the same path towards a standardized curriculum. What has come out just last week, and I apologize, this slide is absolutely awful, but this is a press release, it's terrible, that came out last week, and it was our director, Dr. Susan Hass-Miller, who's the chair of the Centers to Champion Nursing, came out embracing the articulation of our nursing plan. And I would just all like for you, whatever level you're at, we all need to be aware that we've been trying to get this for a very long time. And it is finally happening where we're having that, the seamless and coordinated attempt to package our nursing education in a way that will be on par with what our citizens need and with what other professions. We've got ways with other professions to go. As you know, it's PharmD, physical therapy has a doctorate, speech therapy has doctorates, and we're not there yet. We have some entry into practice issues, but we feel that this is a good place to start, and we've got a lot of other really smart people that agree. And so they came out with this press release, and it said basically that we all need to work towards that streamlining. We need to try and make sure that the associate degree is designed in such a way that it has all the criteria that would lead to a simplified move into the BSN. I want to introduce to you Dr. Linda Aiken. This is Linda. She's, I believe, 71 years old. and she spoke to us this last summer. She is like the Florence Nightingale of our time. And for me, to be in the same room with her was just one of those bucket moments, you know, your bucket list. It was on my bucket list. I didn't even know it was on my bucket list, but once I was in the same room with her, I was like, oh my gosh, you're just like, oh my gosh, I'm in a room with this famous, wonderful person. I just want you to concentrate on all the countries that pop out at you when you look at this other terrible slide. But Linda Aiken is renowned around the world. Her opinions about nursing and healthcare are sought and appreciated and implemented around the world. And we were very fortunate to have her also on the IOM committee, creating this wonderful document that we all want to get in place. And that is let's see if I can switch it out here. Okay. I want to share with you just a couple of slides from Linda. Let's see if I can, oh, here, I see, a different way. There we go. Okay, Linda is probably the most well-known for her research into the levels of nursing and what levels of nursing produce the most efficient kinds of outcomes. And as you know, one of the IOM recommendations is that we have 80% BSNs by the year 2020, which is in 8 years. We are going to feel this. All of us in this room will feel this personally. And the reason for that is because we have scarce healthcare dollars, we have a burgeoning population. Never again in the history of our world will we ever have more children than seniors. We're always, forever and ever, going to have more seniors than children. And so we've got all of this coming together. It's like the perfect storm, if you will. And so we had to say, okay, what is the best way for us to take care of all these folks that are going to need care? And what they found is that, and they looked at this very, very, with no emotion, which is how we need to do this. It's not about our individual stories. It's not about how hard it was for us, how we went back to school, and that's not it. The marketplace has told us that we need to educate in the most efficient way. And Dr. Aiken has provided us, along with a lot of other people, the way to do that. And here's some of her research. She found, and I did email and got her permission to use her slides, and I'm thrilled to be able to share her research with you. She found that for every 10% increase of hospital nursing staff with BSNs, there was a 5% lower mortality in failure to rescue. So we go to a hospital because we want to live, right? I mean, sometimes we go to a hospital and we know there's going to be a death, and there's hospice, end-of-life, palliative care. But for the most part, we go to a hospital, we seek care because we want to live. And we have proof here that when we at least have the BSN level, that's what we're going to get. And I've been given the hurry up signal. Oh boy, here we go. All right. Well, good thing, because I just have a couple more slides I want you to see. This will help you understand. And I hope, are the colors showing up? Oh, good, over there? Okay. Okay, this is, again, Dr. Aiken's research. The one on the left, please just kind of look at that. We've always had multiple ways to become a nurse, and that is fine and good. But we have to refine it just a little bit because of the knowledge that we have about efficiency and quality of care. We have to kind of get up to speed with what our nation needs, with what our ancillary health colleagues are doing, and with what we know we can do as nurses, because we want to be the best we can be. Well, Dr. Aiken found that on the red column there, that is those of us that entered nursing with initial degree of a BSN, 803. And we know that at the same time that most of our grads come to the associate degree level, 785. When we look at how they articulate, what is the percent of opportunity, the percent of the time where we think we're going to get folks back to school to go up to that next level. This is what the data has shown, and this is cumulative data from 1974, probably before a lot of you were born, and up to 2004. So we can see that the ones that came in as BSNs, 179 of them, so maybe about 15%, 16%, I need to do these numbers here, went on to get their master's. And then another 10% of those folks went on to get their PhD, or now we have the DNP as well, which is a wonderful opportunity. So that's what we have with this. We know that we need more BSNs, more MSNs, and more doctorally prepared nurses. We know that from the IOM. We know that from our patient population. And when we look at the other slide, we look at the percentage of nurses that are able to go back, that choose to go back to get their BSN. 157 went back, and about 20% maybe of the population. And then another 49 of them went back for their master's, and 9 of those went on to get their doctorate, which is great and well. It's all good. But when we look at what our nation needs, what we need to be encouraging, what we need to fund, what scholarships are going to be given for, we need to look at how can we funnel and guide the education of nurses into the places that we need them most. And this is, Dr. Aiken's research helps us be really clear about that. I will leave that, and if I could just finish up on the teams, and then we'll be done. Okay, practice. We, as you know, this is probably the slide that most people are going to be identifying with. Let's see, here we go. Okay, transition of care. Like I said, we can call it whatever you want to. Care management, case management, discharge planning. It's huge, and it is the place where I should say the most, because we know medication errors are the highest incidence of errors, but this is where a lot of problems can occur when patients move from one level of care to the next. Things are forgotten, or it's not appropriate, or whatever reason, it's not done well. And this is mentioned 13 times in the ACA, the healthcare reform document. So it's going to be a huge focus on transition of care, and rightly so. We know that we have electronic health barriers, but we're so hopeful that a lot of those hiccups will get worked out, and that will become not the burden that some people see it as, but truly as a wonderful tool, as a way to shorten our work and make things easier. And of course, our lifelong learning goals, which we know that. And lastly, in Missouri, we are looking at creating a workplace solution where we can have a virtual, interprofessional workforce and leadership development center. And I put that in a cloud just to emphasize that it will not be bricks and mortar. We've moved on beyond that because of technology. We don't need a physical home for it. We can do all of this online, but we need to have a way of tracking the data about who are we, where are we practicing, are we thinking about retiring, are we going back to school. That will help make decisions, help other entities make decisions about, do we need more scholarships in this area? Do we need more PhDs over here? Do we need more BSNs over here? And help us to meet the needs of our population better. And the way that we do that is that for all of you that are Missouri nurses, and you will be soon, I would like to encourage you to go online, and every single nurse in Missouri, 93,000 of us, received a letter, and it asked us to go online to the Missouri professionalhealthregistry.com and answer just a few questions about demographics, and so that we can track better who we are, where we are, what do we need coming up. And that will really help us. But we're hoping to create that as an outgrowth of the Action Coalition. We have also our way of communicating is through our website, which is being developed. I left it last night, as a matter of fact. It is so close. I think it's going to be birthed next week, October 2nd. So it's Missouri, or moactioncoalition.org. And also our wonderful parent supporter, the Center to Champion Nursing, has a new website too, which came out 2 weeks ago. So it's been a wonderful time for me to really learn, and I'm just learning so much about this because it was not my area before that. But you can go to either one. I would, for right now, for this evening, or for any reports you need to do on this day, I would encourage you to go to campaignforaction.org, and you can pick any of the 50 states. And one of the wonderful things that I get to do in this role is I get to interface and dialogue and talk with you guys and everybody about how can we make all of these things in the IOM come true, and how can we make them come about faster, so that we're not talking about improving things for us. Let's be clear about that. This is not improving things for me, Amy the nurse. This is making us better as a profession, as a group of nurses who want to help, to give better care to our citizens. And the other thing that I'd like to share with you is the next set of conference calls. If you're interested in advanced practice, that is always on Mondays. It will be October 29th. Education is on Tuesdays. I hope many faculty will call into this day. And Halloween is practice, leadership's on the 1st, and then workforce is on the 2nd. We are having a strategic advisory team meeting on November 5th, where magic happens in these things. And then next summer, if at all possible, we would love to see you at the Team Summit, June 5th and 6th. We're switching cities. This time we're going to have it in Columbia at the Holiday Inn. And this is my contact information. I'd love to be of assistance to you in any way that I can. And there's my wonderful family. I'll go back to this one, so if you can write it down. Okay. Thank you.